I want to welcome folks back to our series of interviews that we're doing leading up to the Maine town meeting on June 1st. And our guest today is Alex Rezk. Good morning, Alex. How are you?
Morning, David. I'm well. How are you?
Good. Before I start asking questions of Alex, I want to remind people that this is a lead up to the Maine town meeting, which will be on June 1st. We are going to do a hybrid format this year, so hopefully we'll be able to have some people in person, and we'll start doing the invitations for that first on Facebook, and then following up with MailChimp, and also sending some letters to people on our mailing list as well. So you should get plenty of invitations, and hopefully you'll be able to join us for the interviews, the weekly interviews, and then for the actual event on June 1st. So Alex, how long have you been with the Margaret Chase Smith Policy Center?
So I actually started working at the Margaret Chase Smith Policy Center way back in the summer of 2018. My original introduction to the Policy Center came by way of an assistantship I had received through the anthropology department at the time, being a doctoral student, with Dr. Marcella Sorg, in her capacity as a forensic anthropologist. And her and I were teaching forensic anthropology, and that ended up leading to me being involved with more branching work. And I had originally come on board working with some of the mortality surveillance that Dr. Sorg's team works on here at the Policy Center, particularly around the National Violent Death Reporting System, or NVDRS.
And you mentioned forensic anthropology. What is forensic anthropology? We hear forensics a lot in the news and in TV shows. What is it?
Yeah, so forensic anthropology is really a form of physical anthropology that focuses on the peri, and post-mortem period associated with human remains. And there's a lot of things that people are introduced to from pop culture via television and procedural crime shows that, and even more so now today with true crime and true crime podcasts and the like, that shows little bits of that world. But what a lot of it really has to do is with creating biological profiles for unidentified remains. So as anthropologists, when you think about forensic anthropology and the work that Dr. Sorg does in that capacity, it has a lot to do with trying to figure out who somebody was when the capacity to do so otherwise would no longer be present for folks in the role of police or the medical examiner's office, who have more experience dealing with remains that may be less decomposed.
So is there any direct linkage between this forensic anthropology and the nonviolent death reporting system, or is it a different way that you came to this role that you have with the Policy Center?
So, and I think this is an interesting feature of work at the Policy Center. I think some of us take circuitous routes to the roles we end up filling in the long term. It's related but distinct. Dr. Sorg's work with the Office of Chief Medical Examiner in the state of Maine, relates to the forensic anthropology, but in regard to the violent death surveillance that the team works on, that is separate, but it's all similar in the sense that it occupies a space in public health that has like characteristics.
Okay. And so what do you have a specific role within this nonviolent death reporting system?
So that, has not been the work I've done in the long term. Interestingly enough, that segued into roles related to substance use disorder policy. So in the years that I've been working here at the Policy Center since 2018, we had several shifts happen at the state level in Maine. For example, we had administration level shifts and governance, and along with that came certain changes in political initiatives around public health surveillance and public health response. So as I started to work increasingly across some of these teams related to violent death surveillance, concurrently, the Policy Center started to get more involved in work through the Department of Health and Human Services, particularly the Office of Behavioral Health and other state partners, working with Governor Mills' initiatives around responses to the opioid epidemic. And the primary role I fill on the team currently is as a project administrator for our Naloxone distribution initiative here in the state of Maine. And at the Policy Center, our team serves as a contractor and a policy partner with folks embedded in state government, like partners in the DHHS at either the Office of Behavioral Health or Maine CDC, and then also state partners who are both public and private throughout the state and its communities. This can include municipal health agencies. It can include harm reduction agencies. It can include, clinical sites like hospitals and other partners. And so it's interesting how you kind of end up branching into these different roles that are perhaps distinct in some of their funding sources and some of the allocations of intent from a government side, but really are all linked together through these, through lines of public health. And that is where I've seen a lot of connection happen between these different silos.
So it sounds like there's sort of two different areas. One is the surveillance and the data collection, but you're more working on the response end of what the Policy Center is doing to try to address some of these substance use disorder issues in the state of Maine.
Sure. And I think that my background, I'm an anthropologist as well, as I noted, and I have a particular focus in my doctoral research around public policy related to risk mitigation and disaster response in an environmental and health context. And so I think that some of the things I bring to bear in our workflow and in our integration with state government is, the capacity to interface across a diverse number of environments with a diverse, number of actors from different silos that have different considerations and characteristics. And, so for example, with the Maine Naloxone distribution initiative, one of the primary projects I spend my time working on that was launched in 2019 by an executive order from Governor Mills to increase access to life-saving interventions to prevent fatal overdose throughout the state. And in order to facilitate that distribution, we here in the state of Maine essentially had to build from scratch a distribution infrastructure. And doing so required the facilitation of state steering committees, and more than anything else, bringing together a cast of very broad actors from different perspectives and different practice orientations and with different ends in mind for their organizational needs, together in the like mission of increasing the saturation of communities in life-saving medication to prevent opioid overdose. And so while that is accompanied and concurrently carried out by our team with surveillance and data collection, which are primary goals of some of these national funding structures that support these projects, like Overdose Data to Action, for example, a congressional grant. It also requires a lot of what I view as public anthropology, which is engaging with stakeholders and embedding oneself in the humanistic processes that actually facilitate, policy outcomes. Because at the end of the day, these are systems of individuals, systems of people, these are networks and social entities. So we see our role at a public research institution as being apolitical mediators and administrative assistants and facilitators for a lot of these discursive spaces that end up happening. And something that's been very fulfilling, I think, for us at the Margaret Smith team, working at the midst of all these projects, is we've gotten federal recognition from the federal CDC and other entities for just how well Maine does at integrating some of these different public and private and governance contexts. So for example, one thing we hear time and again from the federal side is how unique Maine is and having these really strong links between public health and public safety. And, we assist in facilitating some of the spaces in which that happens, whether they be data sharing committees or, providing opportunities like Dan does with the Maine Drug Data Hub to have integrated surveillance and data transparency to the general public, but then also internal communicative assistance and integration with a lot of state processes that facilitates, I think, a through line to some of the salient stakeholder oriented recommendations from policy advocates and policy experts on the ground to those kind of process structures that can inform best practice when actually recommending strategies to either legislative bodies or policymakers. So, I think that it's very fluid and it's been a really dynamic, interesting experience.
You referenced Dan, that's Dan Susi, who we've already done an interview with, and he talks some about the Naloxone program. Can you quantify how much Naloxone is being distributed?
Sure, yeah. So in our most recent policy report, which has tabulated distribution since the start of the program in July of 2019 through March of this year, we've distributed upwards of 160,000 doses of Naloxone. Concurrent with that, we have tabulated just from our public health and harm reduction partners, nearly, I'd say 4,000 voluntarily reported overdose reversals. And one of the things that's interesting about that is we know that's an undercount because many of the overdose reversals are private and would be non-reported. So these are people who elected to tell us or that have been reported through our community networks, one way or the other. Alongside the public health and harm reduction context of distribution, there's also been a public safety distribution of naloxone. Now, before Governor Mills took office, she was the Attorney General. And during her time as Attorney General, she actually advocated very early on for some of these progressive harm reduction reforms to be folded in to state governance. And so in 2016, 3 years before we would launch the MNDI, she had started law enforcement agencies distributing naloxone. And from that point forward, it served kind of as a blueprint for the larger naloxone distribution program that's now efficacious in the state. And since 2019, just on the public safety side via law enforcement, we've distributed nearly 13,000 doses of naloxone and had over 800 overdose reversals reported. So all told, between our public health and public safety partners, you're talking nearly 5,000 overdose reversals. And coming in close to now almost 200,000 doses of naloxone, which I think is very impressive.
Is participation by public safety agencies, is that voluntary or is it mandatory?
So it's been voluntary. And, we have a broad distribution of law enforcement agencies across the state that are participating. We have over, I think, 54 that are now on board. In the public health and harm reduction context, the number, so it may help for me to provide a little bit of narrative around the structure of the MNDI. Essentially, how the MNDI is parsed for the state of Maine is that rather than breaking the state up by individual counties, we break the state up into 4 distinct geographic areas. And each one of those is served by a primary purchasing distributor. So for Penobscot County and northern, down east, and kind of northwestern Maine, the primary purchasing agent for the naloxone is Bangor Public Health, a municipal public health agency. For Mid-Coast and Central Maine, it's Maine General Medical Center, a hospital. And then for Cumberland and York counties, some of the most urban parts of the state, it's Portland Public Health. Then we have statewide peer-to-peer coverage through a harm reduction and advocacy group called Maine Access Points. And over that distribution, at any given time, we have 2 different kinds of what we call tier 2 distributors. One kind could be folks who want to have it as a preventative safety measure. So that just want to have it on hand, like a first aid response. We call those have it on handers. And then we have folks that are redistributing it within their communities. And we have between 70 and 100 of those agencies on any given day. And overall, we've had over 200 organizations join the Maine Naloxone Distribution Initiative. Law enforcement has been equally robust, but we note that some of the areas where there's still challenges to expansion are around cultural stigma. And we find that with the optional distribution onboarding for, and it's not, public safety, but not just law enforcement agencies. We also found stigma to be an issue with clinical sites in certain cases and pharmaceutical sites and others. It has a lot to do with beliefs around the interaction between harm reduction interventions and drug use. So one of the things we've found that needs combating via education and real world examples of efficacy is the belief that if you distribute a life-saving drug like naloxone, you're going to encourage more drug use. The literature doesn't bear that out, but the cultural belief can still be present to the point where it can prevent onboarding in certain parts of the state. So that's an ongoing project, trying to reduce stigma and increase education.
Do the Maine State Police participate?
Yes.
What about county sheriff departments?
Indeed. Yep.
All 16?
We have some of the county sheriffs. I don't believe we have all 16. And then we do also have a number of county jails and correctional facilities and DOC. Now, one of the things that we have tried to be conscientious of as well is, where the highest risk is for people engaging with potential overdose scenarios. And I can get you, so we have 118 police departments that we have distributed naloxone to, and we have 88 law enforcement agencies that are engaging in overdose surveillance. So these are agencies that would report into, we have a service called ODMAP that helps, state agencies see where activity is happening in regard to overdose hotspots. But one of the things we've tried to keep in mind is that people encountering criminal justice systems in particular tend to be some of the highest risk persons for fatal overdose, especially when leaving incarceration contexts. And so, assistance with SUD during incarceration and then continuum of care for SUD related treatment, whether that be medically assisted treatment for an opioid addiction or, continuum of care to services like rehabilitation or housing or other forms of recovery is something we're looking at very closely right now as a state here in Maine, trying to improve our resources for and increase capacity to meet that need. So we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 county sheriffs currently participating with ODMAP. And we have 54% currently of the police participating in this surveillance. So, I mean, I would say that we're doing very well, all things considered. And I believe participation is only going to increase from here on out. Because the culture, I think, is changing. People are starting to see more and more the real world impacts of coming on board, either with something like naloxone distribution or overdose surveillance. And thinking about how many kind of opportunities the state is providing for folks who may not be educated about this to learn more. The governor has been running an opioid summit every year in the summer, and there will be another one this July, and those bring together a lot of these partners, be they from public health or public safety contexts, especially from like municipal health agencies and police departments. And you see not only some of the projects that folks are working on in real time, but also testimonials from people who have survived an opioid addiction or been successfully rescued by naloxone in the past, talking about the difference it made in their lives and how some of these policy changes can save lives and improve people's quality of life.
You referred to the OD map. Is that something that's publicly accessible?
Not specifically in terms of viewing it. However, people might know about it via text spike alerts. So like there is a system in the state where people can enroll in text alerts for overdose in various communities.
Mhm. And just occurred to me because it's been something in the news recently. I think the Maine legislature recently passed a new Good Samaritan law in terms of things like naloxone distribution and reporting drug overdoses. Do you know anything about that and have any comment about it? Because I've heard it's like one of the most expansive Good Samaritan laws in the whole nation, and
Yeah,
being
so
something that will help in the
so
harm reduction.
and the law, I believe it's legislative decision 329, and I believe it was passed in 2019 originally. The Good Samaritan law does provide it provides certain protections for people calling for emergency services. If the primary reason for the call was they or someone else is suffering from an opioid overdose. And so there is a Good Samaritan law in place, and people should feel comfortable calling for emergency services. One of the biggest things that we always try to impress upon the general public in our educational materials and across our network of partners is that there are two things that make the largest difference in whether or not a person's going to survive. The first is calling 911, and the second is the administration of naloxone by an active bystander. And so those two things together make all the difference in the world. And there are a number of concessions and the liability, side now that make for a much more easy time doing that, and people should feel more comfortable doing that. Naloxone is legal in the state of Maine. There are provisions for the allowance of things like sharps needles for the administration of injectable naloxone. And Maine's Good Samaritan law does provide protection for people calling for someone's rescue.
Have you been trained on the administration of naloxone?
Yes.
How does one administer? You said you implied that there's an injectable version, and is there some other version too?
Yeah, and actually we here at the Margaret Smith Policy Center have developed a low barrier to entry educational tool that's not a whole replacement for training, but can be a stopgap measure in an informal education tool called the ODME mobile app, and that can be found on the Google Play or Apple App Store. And that'll actually walk folks through the use of either injectable or intranasal naloxone.
Okay.
Now, to answer your question, there are several different kinds of naloxone that are available writ large, like at a national level, clinically speaking. Here in the state of Maine, the two primary forms that we offer are intranasal, which kind of looks like, a nasal diffuser that you would use for an allergy medication, say. And then there's an intramuscular, which comes in the form of an injectable syringe. And the most common is the intranasal. And the use of that is as simple as, after you've situated the person experiencing overdose in a way that they're ready to receive a diffuser, using the nasal applicator and administering a dose into one or both nostrils. And some of the most important things that we like to impress upon folks who may be using naloxone to respond to an overdose is that you need to time your administration correctly. So you can wait like 30 to 90 seconds and see if there's a response. And if there is no response, administer again. And then also to note that naloxone does have a half-life in the body. So many times people who are in acute overdose may be revived. And even if you are responding as a bystander, it's best practice to still call 911 because they may still need aftercare. For example, naloxone might only last for 90 minutes in the body. if that's the case, and the person was heavily intoxicated enough with an overdosing substance, they could return into overdose once the naloxone has worn off.
Mhm.
So we really want folks to know that naloxone itself is not a replacement for overall emergency response, but that we do have tools out there in the community to help people get trained. Furthermore, all of our tier 1 organizations and many of their tier 2 organizations who distribute naloxone through the state provide resources and either direct training, not only for individuals, but also for work sites, and are happy to interface with folks as they need outreach. I would direct people who are interested in some of this to check out our website, getmainenaloxone.org. And getmainenaloxone.org has information about where you can find naloxone through the MNDI. I'd like to note, in case it wasn't obvious, the naloxone that this program provides is free of charge. And they can also find access to educational materials, the app, PDF handouts, and other kinds of resources that can help them get acquainted with the information.
And when I post this interview, I'll make sure that I'll put that web address in there that people can find more information.
Sure.
So I want to thank you for a very thorough explanation of MNDI, the Maine Naloxone Distribution Initiative. But I want to make sure to leave some time for another interesting project that you've been working on. And it relates to the issue of shortage of volunteer firefighters in the state of Maine. Being a very rural state, it's something we very much rely on, and more in the news, we hear these issues that a fire starts and fire companies can't get enough people come, especially during daytime working hours. So tell us a little bit more about this project that you've been.
Sure. Yeah, this is a really interesting project. I got involved with this because we actually received a stakeholder request to do research in this vein. A volunteer fire chief from Hancock County had approached the center and asked if we had the capacity to do essentially a needs assessment for the volunteer fire departments throughout the county. Being that I was researching, public policy at the intersection of climate and health and risk and disaster, this was right up my alley. So I jumped at the opportunity to get involved. And what has happened is a deep dive into the county level vulnerability of the fire service. In Hancock, in Down East Maine, close to the University of Maine's flagship campus, so relevant to our part of the state in that sense, and relevant to our lived experience, is really, in our opinion, indicative of a statewide crisis. And so in the time that I've been working on this project since 2019, we have scaled up from conducting a county level assessment that has been twofold. The first phase of which was a qualitative ethnographic engagement with all of the fire departments in the county. The second of which was a quantitative survey distributed via Qualtrics to all the departments in Hancock. That has branched into now a statewide working group facilitated by my team with the Office of State Fire Marshal.
Okay.
That is looking to receive funding support for a statewide needs assessment that looks at all the departments in the state, including rural volunteer fire departments, but also municipal and career fire departments. Essentially, what we found, just looking at Hancock County, was that there is a severe deficiency of support structures in place to ensure that the fire service has the resources it needs to effectively do its job. And it's a twofold problem that is not just local to Maine, but national, but is most acute in states like Maine that are rural and heavily reliant upon volunteer fire departments. And it's, on the one hand, a crisis of personnel, but on the other hand, a crisis of government infrastructure. For the longest time at a national scale, the fire department and the fire service writ large has kind of been taken for granted, in the sense that it's not as directly supported as some of the kind of other public safety avenues people are familiar with. I come from a big city originally, New York, where we have what I would say is almost a paramilitary fire department, right? And when people move out to places like Maine, as you're now seeing with a lot of the urban flight during the COVID pandemic, people have no idea how different the structure is at a municipal scale, especially at a town or county level in a state like Maine.
Mhm.
And yet, those volunteer fire departments, while they may not be as densely staffed or heavily fiscally supported by their communities, are the first line of response and the first line of defense against any number of catastrophic events, be they car accidents, fires, king tide flooding,
Mhm.
structure collapses, explosions, the likes of which we've all seen here in Maine in the past 5 years and any number of occasions. Some as recently as very recent with some of the hotel fires we've had on the coast, and then notably, I believe this last weekend in New Hampshire.
Mhm.
We had a major fire, which is indicative of the same kind of problems we're having here in Maine. So it's not just statewide, it's regional. And so what we're looking at basically are ways that we can recommend changes to the current administration of infrastructure such that personnel and material needs can be improved. One of the key problems is that the time investment in becoming certified as a volunteer firefighter and the needs of the communities at hand are growing year on year,
Mhm.
where the capacity for people to actually do that and feel supported is dwindling. And a lot of this has to do with the fact that people don't have the kind of free time they once did to
Mhm.
volunteer. Employment is less flexible in many ways in the modern world, especially in rural communities. Travel time is a mitigating factor. But then as communities experience youth flight and the median age of communities in Maine increases, there's also less able-bodied young people with the availability to serve in these roles. So our expert force is essentially aging out,
Mhm.
while there is not necessarily a population to replace them, and yet the need is not going to disappear.
Mhm.
So something about the priority focus of the systems that uphold this infrastructure needs to shift. And one of the things that we're looking at is how communities and counties and municipalities can hybridize their partnerships, can increase mutual aid, and can perhaps offer regional safety nets across their departmental service offerings to try and close gaps where they exist.
Mhm.
And it is a really intractable problem, but one that we're trying to bring econometrics to bear on, social science, and a whole bunch of other considerations. And we're working pretty closely with fire stakeholders to do so. I'm currently waiting to hear back on a grant proposal, for example, we submitted to FEMA
Mhm.
to see if we could get some federal interest. And we think that this is going to be a cutting edge in terms of need here in Maine, because as the climate crisis worsens and as especially we experience in-flight of migrants from other parts of the country in terms of people newly moving to Maine, you're going to have what I believe to be a dissociative effect between what people expect of their community emergency response infrastructure and what's capable of being on offer. And I think that, a lot of people now are paying more attention to this because of the COVID pandemic and the highlight it brought, not just to fire, but to combined fire EMS.
Mhm.
And I think that there's a lot of ammunition there for, operationalizing people's interest and the sense of urgency they might now have thinking about whether or not their communities are protected in some of these base ways. And it's a very interesting project.
Well, thank you for sharing information about it. And one of the things we're trying to highlight with these interviews is the very direct ways that the Policy Center is involved with public policy issues. And you've just highlighted two areas for us where you're very directly involved with trying to improve public policy in the state of Maine. So keep up the good work.
Thank you, will do.
All right. And so again, I want to remind people that we're offering these interviews with staff members at the Policy Center, again, trying to highlight the ways that the Policy Center is really affecting life in Maine, policy in Maine, and hopefully you'll continue to watch those as we lead up to the Maine town meeting on June 1st. And we'll be checking your different media outlets for ways to register for that, either in person or via Zoom. So Alex, Rezk, I want to thank you for sharing the work that you do at the Policy Center.
Thank you so much for having me.
All right, so long.